Afternoon, everybody. In week 3 of our Taking Action for Your Health campaign, we're focusing on skin cancer. Earlier in the broadcast, you saw Linda Hurtado's report on the trend to radiation, or I should say electron beam. Experts say that a significant number of skin cancers can be treated without surgery. Also this week, Linda has special reports on the latest tool in the war on skin cancer. It's called MelaFind. And on Friday, you'll see how melanoma specifically can have deadly effects on other organs. Joining us in the studio with more, we want to welcome Dr. Gerald Sokol of the Florida Cancer Specialist. Thank you so much for coming in.
Good afternoon, Lizette.
You were saying that radiation is a word that you prefer not to use. You prefer the electron beam. Tell us why.
Well, a lot of people associate radiation with X-rays, with deep penetration, with total body doses, with lingering metabolic effects, where electron beam utilizes electrons just like the light bulb does. And we're able, depending on the energy of the electron beam that we select, to just spray a lesion. And depending on the energy that we use, we can go very shallow, deep, and then it stops. So you don't have to expose a lot of tissue to the treatment area. So spraying with electrons is very different than X-ray kind of radiation. Aside
from the obvious benefit of getting your skin cancer eliminated, what are some of the other benefits? Are there less scarring? Is it if the patient has other health issues like diabetes, for example, with surgery, that can be difficult?
Well, there's no cutting, there's no bleeding, there's essentially no pain, and there's very little scarring because there is no surgery or cutting. Patients don't have to stop their blood thinners. They don't have to worry about their blood sugar during treatment. They don't have to really worry about the chance of infection. Healing is very rapid.
Right.
So it's a very benign, highly effective form of treatment that's very cosmetically salvaging.
And we were talking about the different kinds of skin cancers. So many folks think melanoma, but in your practice, you're seeing many other kinds of skin cancers.
Well, 99% of skin cancer is non-melanoma. There's 1 million non-melanoma skin cancers in the United States. Most of these are basal cell cancers, maybe 70 or 80%, 20 or 30% are squamous cell cancers. These are all very amenable to treatment. So I'm not saying don't see your dermatologist or don't see your surgeon, but this is an extremely viable alternative.
And not to be scared when you hear that diagnosis of skin cancer, because there's treatment now.
Very much so.
And just to end the segment with some advice for our viewers at home who may be watching, maybe they've been watching a mold who's changing a little, what advice do you give them?
Well, by all means, see your doctor, see your dermatologist, but get another opinion about the alternatives. That's our responsibility in medicine, to provide the alternatives that are just as effective and may be much, much better for an individual.
I guess when folks feel like they have different alternatives, they're more likely to seek the advice of a doctor. They're more open to the treatment. It's not so scary.
They're in control. They don't have to have one form of treatment. They don't have to get cut on. They don't have to have surgery. They don't have to have body parts removed. They're alternatives, and that's the message.
Well, we like alternatives. Thank you, Dr. Sokol, for coming
pleasure.
in. It's so nice to meet you. And
likewise.
If you at home would like to see all of the reports that Linda Hurtado is doing throughout the week, we will be posting them on our website at abcactionnews.com/health and also on our Facebook pages. Thanks for watching, everybody.